Hello. We'll go ahead and get started. We're close to 100, so we'll go ahead and get started. I really don't have just a ton today. The case count will be at 155 when we update the cases today at 4 p.m. So that is 3 more than yesterday. 98 of those cases are associated with DOC outbreaks. So that's important to know. And then our active cases, out of those, 4 of those are not DOC related. So most of our active cases are DOC related. So there is an outbreak in Bonne Terre, and there's also an outbreak at Farmington as well. Bonne Terre has finished up all of their testing. They were doing sentinel testing, which is really surveillance testing. So they finished that up. They're just waiting on some results of some inconclusive tests that they had to go back and retest. And then Farmington has started their facility-wide testing this week. So we expect to see more cases as we get results in, especially from Farmington. So I point out a couple of those things, that the majority of those cases, and remember that 155 is the total amount since last March 22nd, when we got our first case. I point that out because when we take that DOC number out of the count, we're in the same spot that we were before. That's not to say that that couldn't change. We're certainly concerned with the possibility of seeing community transmission associated with these outbreaks, and we really won't know that for another couple of weeks. Remember, the incubation period is 14 days. So it's very possible that we could see community transmission associated with these outbreaks. Now, we isolate, quarantine, do the contact tracing, but, again, we want to keep a close eye on that because that's certainly a possibility. But again, when you pull those numbers out, we're really in the same spot that we were before the DOC outbreaks, but it's something to stay on top of and keep watching. Because of the DOC outbreaks, if you are still taking a look at the state's data on their COVID dashboard, they've updated that in the last month. So it's got a lot of good information on there. We are listed as one of the top 10 counties for percent growth because we did have a large increase in cases over a very short period of time. So again, that's important to just be aware of. And, we've talked a lot about zip code data and that, the virus is out there. It's not going away. So really the best thing that we can do is to treat every person like they have it. And that may sound a little bit over the top, but that's really what we need to do, because when we look at these situations where we're seeing a lot of asymptomatic cases, especially in these outbreaks in the prison, again, anybody could be carrying this. So we just really need to continue to be vigilant. And I know I say this stuff every time and I'm starting to sound like a broken record, but it really is the best thing that we can do to stay home when we're sick, social distance, wear a mask in public places, and I'm going to talk a little bit more about that here in a minute, and use good hygienic practices. And CDC has lots of guidance on their website for all kinds of sectors. We have guidance also that we've put together in a little more of a simplistic format. But there are best practices out there and things that we can do to prevent infections. But we want to keep in mind that we are in mitigation, and that means that we are trying to minimize as much as possible the risk and minimize the transmission of this disease, but we are not going to take the risk down to zero. So that's important to know. I just want to remind, I think I talked about it last time too, but the symptom list has gotten longer in the past month. And so that's fever, cough, chills, shortness of breath or difficulty breathing, fatigue, muscle or body aches, sore throat, new loss of taste or smell, and nausea, vomiting, and diarrhea. And we have recently seen some cases reporting those gastrointestinal type of symptoms as well. So that's important to know. Something that was updated in the last week has been the risk groups. So they've done some changes to that, and you can see that on CDC's website. But, the greatest risk for severe disease, anybody is at risk of contracting this if they're in contact with someone who has it. But the greatest risk for severe disease, hospitalization, ICU, the need for a ventilator, goes up as we age. So if you look at CDC's website, it says pretty clearly that 50-year-olds are a more risk than 40-year-olds, and so on. And then 8 out of 10 deaths have been in people over the age of 65. So we know that as we age, the risk goes up for severe illness. And then the medical conditions as well: chronic kidney disease, COPD, weakened immune system after an organ transplant, obesity, severe heart condition, sickle cell disease, and then also type 2 diabetes make you at higher risk for COVID-19, severe illness from COVID-19. CDC also lists, I'm looking at my computer because I pulled it up because I didn't write it down, the conditions that might be at increased risk. So the ones I just said they have the data, they have that on their website that you can even look at. So those people are at increased risk. And then the following diseases might be at increased risk for severe illness from COVID-19. And they also have data to support these as well: asthma, moderate to severe, cerebrovascular disease, cystic fibrosis, hypertension, that's high blood pressure, being immunocompromised for a number of conditions that are listed. And I will also tag this when we post this video here after we're done. Neurologic conditions such as dementia, liver disease, pregnancy, pulmonary fibrosis, smoking, a type of blood disorder, and then type 1 diabetes. So again, they have this broken down very nicely that shows you this category of people are at increased risk for severe disease, and then some that might be. So again, it's just being aware. We've seen a lot, I think, in the news about fear mongering, and I don't think that it's about living in fear. I think it's about living somewhere in the middle of fear and then also carelessness. And so I think it's somewhere in the middle of being very aware and taking precautions and assessing what your risk is to your family, and then also, understanding that you could pose a risk to others. So, following those guidelines that have been set forth will help protect you and other people. I'm going to just kind of hit on a couple of things that we're working on, and then try to go back and take a look at some of the questions here. It's about 2:10 now. So obviously the DOC outbreaks have had us very, very busy. I know last time when I was on, I talked about a community indicator system. We're very close to rolling that out. I won't go over that in its entirety again. It's on the last video, but basically it'll be a red, yellow, green system supported by data that come along with some kind of extra guidance. Again, they're not mandates, but they're extra guidance. And, I hope to be rolling that out mid-July. But again, the DOC outbreaks have kept us very, very busy, and we're very much so at max capacity at this time. So hopefully we'll be able to roll that out soon, and I'll hop on a live and kind of explain that as well when that's ready. And then just really diving very deep into looking at our data, and again, making sure to stay on top of community transmission. And we've had a lot of exposures recently that we've been doing a lot of contact tracing on, that we're connected to like other counties, that type of thing. So just been very, very busy. And we would ask that, if we're calling you for contact tracing, I did communicable disease out in the health department before I came back here as assistant director for a few years. And, I would say say 99.9% of the people who we talked to at that time were very cooperative. They understand that our job is really to prevent disease, and so we want to keep people healthy and well. And so when we're calling to do contact tracing, that's really what we're doing. Since COVID-19 has come along, that has shifted, and the cooperation is not what it once was, and that really puts the community at risk. And so when we're calling, doing contact tracing, this isn't a new system for us. We do this often because we investigate communicable disease all year round. And so we just ask that, people are kind to our staff. Please don't cuss us if we call. We are trying to take care of you and the community, and we appreciate everything that you're doing to help us on that end. But we would just ask that people are as cooperative as you can be. Again, we're looking to identify more cases and keep that community transmission at a low level. So I think that's it for now. I'll kind of circle back to some things, trying to go back through. There's not really a ton of questions, I don't believe. I think somebody asked, how important is it to wear a mask in public places? I think we've talked about that a lot at length. It is very important. It is the recommendation of the CDC. It is our recommendation that all persons who are in public places that cannot social distance 100% of the time wear a cloth face covering. So that is the recommendation. I know that, again, that's another one of those highly politicized items here in the fight against COVID-19. But again, this is really about protecting lives and preventing transmission. And yes, most people will recover from this disease. That's true, but some will not. And I would encourage all of us to remember that community matters, and I think all of us care about our fellow neighbor, and don't want to see anybody get sick from this to the point they need to be hospitalized or a ventilator or in the event of death. And so again, this is a practice that prevents disease and can save lives. So we would ask that people wear masks in public places. Is it going to be mandatory? Is it going to be mandatory as less and less people are wearing them? We've had a lot of questions in the last couple of days about mandatory masks because St. Louis made masks mandatory. I think there's a lot of things surrounding mandatory masks. We need to keep in mind that St. Louis is different from us. The response to regulation is different from our political climate here. And, we need to be careful about mask shaming and things like that. I've seen a lot of things like that. But it doesn't help to shame people. And so we want to be understanding and meet people where they're at and give good education as to why masks are recommended by the CDC. So to answer your question, at this time, no. I think the enforcement piece is really important when we think about mandatory public health orders. I think, as time has gone on through this, we've learned a lot about that. I did see, I was reading about the St. Louis order, and the mayor had said that the public will enforce that order. So I'm not sure what exactly that means, but I think, we've been giving this recommendation, and, we encourage people to follow this because that's how we prevent disease. But I think there's a lot of things that go into the mandates for masks. And so I'm not saying never. I'm just saying that there's a lot of things to consider in that. And again, I think the best thing would be for all of us to follow the recommendations that have been given. If we donate blood, will they test for antibodies, and would they notify us of the results? I did read something about this, but I'm not 100% sure, so I don't want to answer this question with a presumptive answer. So I'll have to do some deeper digging on that. What I did read was that they do test for antibodies, but again, questions about will they notify you, that result should be sent to the health center. If you're a resident of our county or wherever you might live, that should be sent to the health department, and then they might notify you if you might be a case. But if you have questions about how blood donation works, I would refer you to that entity that you're donating blood with, the Red Cross. But I'll have to look into that and get you an answer on that. I think the answer is yes, but I don't want to answer just too quickly. How important is it for local businesses and city-owned public properties to properly clean and disinfect? Because I got in trouble for reporting a coworker at the Civic Center who was not properly disinfecting and conducting proper cleaning. Again, I would, encourage people to follow the CDC recommendations. I know there's been a lot of, can't find disinfecting wipes. We've had trouble with that. We've been using a bleach solution. But CDC has that lined out on their website. And, the information that's on CDC, these things are backed up by science and data. And so I would strongly encourage, entities, businesses to follow those guidelines and recommendations, because they're out there for the public to see right now. So I would really, really appreciate if people would take a look at that and follow those. So I'm trying to get through here. What about people with food that can't breathe, with one on, and kids, I think, with asthma? Okay, sorry. I think there was a typo. Sorry, COPD. What about people with COPD that can't breathe? Yes, so I think she's asking about masks. If people have a condition that they can't wear a mask, that's okay. That's why it's even more important, though, for people who can wear a mask to wear a mask. And similar to vaccines, there are people who cannot get vaccines. And that's even more important for the people who can get vaccines to get those, so that, again, we're protecting the community. Again, I know I talked about this last time, but it's not so much about me as it is other people. And so when I wear a mask, I protect you. When you wear a mask, you protect me. But yes, there are certain conditions that people can't wear a mask, and that's okay. And children under the age of 2, per the CDC, should not wear a mask. So again, that just adds to the fact that we all need to follow the recommendations if we can, if medically we are able to. So trying to get through here. I've got to hop off. I'm sorry. Is there vaccine shots available for this year? I need to get vaccine shots because of my health issues that I have. I'm not sure if you mean for COVID-19. The vaccine is not available yet. We're not 100% sure when that's going to be available. But if we're talking about just immunizations in general, we are open for immunizations, but it's by appointment only. So please give us a call. I see Dr. Damba, she's on our board. She's answering the question about antibodies for the Red Cross. For a limited time, Red Cross is testing. Results will be available on the app. Thank you, Dr. Damba. Are you contact tracing positive cases from DOC? This seems like a difficult task. So we contact trace the employees, and then assist with the offender side, because they have their protocols for if you are positive as an offender, and also if you're a cellmate as an offender or of somebody who's positive, or if you are a contact to them. So they have a system that they're using. They actually go so far as to review surveillance data for the cameras, that type of a thing. And so we work with them on the offender side, but our deep contact tracing for us is that employee, and then work with them on the offender side so that they can do their internal contact tracing. Okay, I'm over on time. I'm going to have to hop off here. We'll try to go back through, although I don't think there's a ton of questions coming in. Again, you don't have to wait for lives to ask questions. If you have questions, please call us. We are closed tomorrow in observance of Independence Day, so please have a happy 4th and safe 4th of July. We will not do number updates tomorrow. The next number update after today will be on Monday, but we are investigating cases within 24 hours of receipt of a positive. So that means weekends, holidays, that type of thing. We appreciate everything you're doing. Now is the time for all of us to be united. I think we've seen increases in cases in other parts of the country. And obviously right now, we're seeing increases here due to these outbreaks. And, we're going to continue doing good disease investigation. I do hope that very soon we will have testing up and running. And when we do, we'll be able to make that announcement. We're not there yet. I want to be very clear about that. But we are working on that here at the health center, but right now very, very high volume of investigations, and we really are at max capacity. So again, we appreciate you. Good hand hygiene, staying 6 feet apart from other people, wearing a mask in public places. These are the things that are going to prevent disease and protect our most vulnerable. So we would ask that you do those things. And again, reach out if you have questions. Thanks.